We are back on Taking Care of Business on Koerner Radio, News Talk 1180, 1230 KGEO, and 1410 KERI.
And what's that place in New Mexico?
Oh, yeah, I forgot about that. We're also on 1000 AM KKIM in Albuquerque, New Mexico, as of this week. Our guests in studio, Mark and Cathy Abernathy.
I wanted to talk a little bit about the state before we get into the national, because the supermajority is going to really have a real negative impact on all of us residents. And I understand that there's some discussion about taking away Proposition 13, which could really destroy a lot of the housing market.
Ow.
Any truth to that you're aware of?
Well, the Liberals have been trying to take away Proposition 13 ever since it passed. And when did it pass? Was it
mid-70s or?
78.
78, yeah.
78.
Yeah.
And they hated it then because anything that takes... That's like putting the lid on the cookie jar, and they want that lid off. And yes, they constantly pushing for ways that they can undo Proposition 13 and get into that cookie jar and get into your home and your property taxes.
With a supermajority, what can stop them?
They may not be stopped at this point. The only thing that would stop them would be the threat of another initiative. That would a referendum that would anytime they pass a law, of course, even though they have a supermajority, the people can referend that and overturn that law, and that referendum would be immediate if they overturn Prop 13, and so that could stop them. But now that they have so many of the business and professional organizations that the government controls so much. And these businesses and professional organizations are so afraid of the government's further controls upon them that it's like a club over their head. So now the Liberals in Sacramento can get the business organizations to support them in whatever they do, as long as they don't hurt that one business. So what you do is you pick out each one and you say, I'll take it easy on you if you will help me, kill your brother.
Wow.
Now, we saw that going on here with the California Dental Association. They came in here with ads against the Republican candidate saying, it's dangerous for this Republican to get elected. He might go to Sacramento and raise taxes, which is such an absurdity, an argument, and local dentists didn't know about it, didn't support it. But the lobbyists up there, they spend all their time with the speaker and his people, and they say, hey, you do this little favor, that little dental position you want in Sacramento, a state board of dentistry, and we can make that happen.
Another issue that is close to my heart, unfortunately, or fortunately, however you want to look at it, is health care. And with the new exchange program, you can make up to $92,000 and still qualify for government assistance.
What?
Now under the health care bill.
$92,000?
$92,000 a year. Oh. And now California is still pushing for a single-payer system.
Yes.
Which I think ultimately is what the Obama administration is really trying to get in place also, as a single-payer system.
Of course.
Yeah, and it's going to be a wear on our services because we don't have the services for a program where people aren't bringing in private money. I also haven't seen any movement by the government, and it should come from the medical community of where are all these med schools? Where are all these doctors?
Yes.
And what are we doing about our public school system that isn't getting people educated enough to make it through med school? Mm-hmm. You can't produce doctors unless you produce people that know chemistry and physics and all these things. So it's going to be a serious issue, and it's supposed to kick in 14. I'm still wondering if the Republican House can slow it down enough that come 16 we can go back at it.
Well, unfortunately, Boehner in the paper this morning said that Obamacare is a foregone conclusion, and it sounded like he's not going to try to do anything to stop it.
Well, it's November 9th, 10th, 11th here. Let's give him a little. Let's just see. I guess he's showing a little olive branch, but if there has been zero cooperation from Obama with the House of Representatives. Now he can ignore them. How much longer? They've been passing bills. The Senate's done nothing. So are the American people going to keep saying it's the Republican House is the problem? So I think Boehner's trying to show we can work with you, but first of all, they don't want to tax people right now with the economy like this. And he's made that very clear, and I'm glad John Boehner said that.
Well, is President Obama going to do like Clinton did in 96, 97, and then in his second term, work with the Republican House? which Clinton did, and Clinton, got a lot of reforms. They were conservative reforms that the Republican House wanted, and
Sure.
Clinton joined up and said, "Okay, I'm a conservative. Let's reform welfare, cut taxes, and et cetera, et cetera." But will Obama do the same? No, I don't think so. And so there's going to be ramifications which we can talk about.
Well, I wanted to stay on health care for just a couple more seconds. One of the other things we had in California was Healthy Families, which was a program for kids where their parents couldn't afford to buy insurance based on income. And you talk about having a single-payer system and how the government's going to support you, yet Healthy Families was a government-supported program, and now Healthy Families is being terminated, and they're rolling all these kids into Medi-Cal. That's one program. You talk about not having money. And so now they're going to roll it to Medi-Cal. Doctors are not going to accept the kids because they're not going to take the lower payments that Medi-Cal makes. And I put over 1,000 kids into that program, which also takes away income from us because we're not paid to put them in Medi-Cal. The second program that they're going to be terminating down the line here is called AIM, Access for Infants and Mothers. We put over 500 girls into this program, and what it did, it covered any maternity situation up till their 23rd week of pregnancy. Now that's going to go away and also fall back on Medi-Cal. So are we really going to have a good, solid health care program, or are we going to have a government program with death panels and these type of things?
You know what I sense coming, and exactly from the scenario you set up, doctors right now don't want Medi-Cal patients. They don't want Medicare patients. Now, Mayo Clinic is cutting out Medicare patients on many aspects of their service. And so the government goal here of Obama, in my opinion, is going to be ultimately government employed physicians. Exactly. That's going to be what we're going for, and that's going to send us right back to, I don't know if you want to say third world, but not the kind of medicine that the world has come here to enjoy and survive with. So I think it's very serious, but I think that's exactly their agenda.
No question about
Well,
it.
what will happen, I'm sure, is that there will be a two-tiered healthcare system. There will be the government system that has been set up to say everybody gets free government care, but that care will be very poor, very slow, and rationed, and death panels, etc. All the things that we don't want. The reason we don't want a national health care plan. But there will be the other tier, which is the underground, which the doctors will perform if they get paid. And that'll be an underground system that the Hollywood folks will all use, and Obama and his family will use, and other people with money will use.
Obama's exempt from the health care bill, as are all the legislators.
They exempted themselves from it. They knew they didn't want it.
Right.
They wanted it for everybody else.
We're spending the hour with political consultants, Mark and Cathy Abernathy. I'm originally Canadian, so I have a lot of family back in Canada, and we have this discussion back and forth. My dad lives in a little community about 2 hours outside of Vancouver, and he needed an MRI the other day, and he had to wait 6 weeks for the MRI machine to come out to town. Unless he wanted to spend the money out of pocket, which would have been $1,500 to have the test done.
Exactly.
That's health care?
Right.
I mean,
that's where is the sample nation of even near our size or close? I'll take Canada, which is not near our size, where it's worked. We're tinkering with a system that is working pretty well. There is a segment of the population that hasn't wanted to buy insurance. Well, some of it are the very healthy and never will die 20 to 32-year-olds in that bracket.
Right.
That mentality doesn't really change. It's also not the top priority for them, not when they're spending hundreds of thousands of dollars getting a college degree. They've got plenty of other things they're spending their money on.
Sure.
But why are we trying to initiate something that hasn't worked anywhere else successfully, and not just solve as the Republicans in the House want to do? Let's work on the issue that we've got, the uninsured, just that group, and not change it for everybody else. And remember, Obama promised us, you're going to have your same doctor, you can keep your insurance, the price won't go up. My premiums just went up. They're all going up.
Sure.
So none of those promises.
I'm really concerned about this, but not much we can do about it right now as individuals. But let's talk a little bit about the propositions that took place in California, if we can move in a different direction, because we don't have a lot of time. Starting with Proposition 30. How is this going to impact California?
Cathy's shaking her head.
I want to meet the people that said, yes, tax me more. I'm guessing there are people that don't pay taxes, or a big chunk of those people. And we have, in California, as we have in all 50 states now, a growing number of people, that don't pay taxes. And
Right.
so they're very happy to raise it on someone else. Of course, they're raising it maybe on their employer, and so their promotion or the expansion of the business isn't going to happen. But it's just hard to believe that somebody actually thought the state of California needs more money. But the campaign the governor ran, I mean, he was on college campuses telling kids, you vote for this, you're going to get a $250 check back because your tuition's going to drop. Kids were calling their parents here saying, vote for Prop 30 because our tuition's going to drop. The mother's saying, my taxes are going up to pay for that.
Right,
What are you talking
right,
about?
right.
And she's paying to put this kid through our colleges.
Yeah, crazy. Let's pick up there when we get back. Okay, we'll take a break and come back. We'll be back in a moment on Taking Care of Business on Koerner Radio News Talk 1180.